All right, this is a case of internal derangement of the knee. We are going to look at the SAG T2 weighted fat saturated images. A lot of the meniscal and cruciate ligament abnormalities can be detected just from looking at the sagittal T2 weighted sequence or the PD fat saturated sequence. I recommend always beginning with this sequence to get a complete orientation of what's happening with the menisci as well as the cruciates before exploring the other sequences to add more information. So let's begin with this case where we are going to start scrolling from the medial aspect of the knee. So as I begin itself, I can see that the posterior horn, much of the signal is high in T2, probably a complex tear involving the periphery of the posterior horn of the medial meniscus, with some signal extending into the menisco-capsular ligaments. The anterior horn appears fairly well preserved all the way to the anterior root. The posterior root as well appears intact. So looks like there is a complex tear of the posterior horn of the medial meniscus in the periphery with signals of high signal, T2 signal extending both to superior as well as inferior articular surface, and there's multiple areas of globular T2 hyperintensities within the posterior horn. So it's a complex tear in the periphery involving the menisco-capsular attachments, possibly a ramp lesion. Now, as we go further into the joint, I can see there's a nice posterior cruciate ligament which is appearing T2 dark and appears well intact. The alignment of the ACL appears intact, the posterior intercondylar surface of the femur, the Blumenstadt line, the Blumenstadt angle, everything is within normal limits. A little bit of intermediate signal is seen within the mid substance of the ACL, which is all right. It's fair enough. It appears to be intact without any tear. Now, as I go further, I prefer to go completely towards the lateral edge of the lateral meniscus and then scroll back inwards into the joint. So let's begin and start looking at the lateral meniscus. Looks like right from the beginning, there is a reduction in the volume of the anterior and posterior horns of the lateral meniscus. As I come closer towards the roots, it appears the roots appear to be fairly intact and fairly normal in volume, but there over here, if you start seeing it, this is the PCL, but just anterior to the posterior root there is a T2 dark signal out here. This could possibly be a flap of the lateral meniscus that has been flipped inwards. How do we know it is because if there is a reduction in the volume of the anterior and posterior horn of the lateral meniscus and you identify an abnormal T2 signal anywhere close to the medial aspect of the meniscus, closer towards the roots, it's possible that this could be a bucket handle tear. Quite often we get the double PCL sign where a flap is seen lying parallel to the posterior cruciate ligament, but in this case there is some meniscal fragment lying anterior to the posterior root of the lateral meniscus. How we can confirm this is we could go into the coronal. Let's have a look at the coronal from anterior to posterior, and as you can see, this is the medial aspect of the joint. The medial collateral ligament shows some high signal intensity along its margins, possible sprain or a grade 1 injury. The anterior horn of the medial meniscus looks good. As I go to the posterior, as you can see, the menisco-capsular attachments and the posterior horn shows a tear. And when I come to the lateral meniscus, I can see that the volume of the anterior and posterior horn is definitely reduced. And look at the intercondylar region. You can see here you have the PCL going across, and here you have the ACL. So the ACL, the PCL, and there is a third fragment over here. So clearly it's a flipped meniscus. Meniscus has flipped into the intercondylar region. It is a bucket handle tear of the lateral meniscus. So almost all abnormalities of the menisci and the cruciates can be picked up in the scrolling of the sagittal images, fat saturated PD or a T2 weighted image, and you can supplement it with additional views like a coronal or an axial to further confirm your diagnosis.